Good morning, ladies and gentlemen. It really is a pleasure to be here and see old friends and many new friends. And a big thanks, I think, to the SHOPS program for bringing us together. I think the issues around youth and family planning are one that are extremely important in India today and globally also today. And I think what's really exciting about a meeting like this is that it's not only just development practitioners, but you've also got members from the community groups and also members from the corporate sector. And I think this idea of these multi-sectoral partnerships and multi-sectoral ways of thinking is really what we need to ensure that we move together and move the agenda to reach 120 million new family planning users across the world. And India is really leading that program forward. And an opportunity like this to really say, okay, what are some of those new ideas we can build that really helps the government program move forward and helps us reach more women, children, and families to improve their healthcare outcomes. And so I think what's really exciting about this meeting today is the ability to bring together unique thoughts and unique ideas and unique ways of doing business, and marrying that with, I think, what India does so well, which is that ingenuity that it has, the use of technology, the strong civil society, the strong interpersonal skills, that knowledge and use of them are going down. How do we revitalize young populations to actually start thinking of these commodities as viable options? And how do we ensure that there is supply and demand available if they choose to use these services? And I think we must ensure also that beyond supply, we're empowering the consumers with accurate information and using them to be able to make their own choices, to see the value of these different types of commodity choices and how these commodity choices can help them improve the quality of their lives. And all of us know that as we look at family planning and family planning programming, we need to ensure that women especially are empowered with the information, skills, and confidence they need to make, where they need to make informed choices about their reproductive health. And as we look today, a big portion of this really needs to be targeted towards young people. As we know, 50% of India's 1.2 billion people are under the age of 25. That's huge. And this has the largest youth cohort in the world. And a quarter of Indian women are married by the time they're 18. And so we know that these young women have the lowest use of modern contraception and the highest unmet need for family planning. And so as a community and as a society of development practitioners and thinkers, we must do a better job to talking to young men and young women about options for family planning, fulfilling their hopes and bringing together new ideas. And I think we all know that engaging youth is very, very complicated. Some of our traditional ways of doing business have not succeeded. And so we need to bring in new ideas of how we can really reach different types of youth. And also we need to understand, I think everyone knows here, that youth is just not one type of monolith. What works with some youth in urban areas in Mumbai may not work for someone in Bhubaneswar. And so I think we have to really look that one size does not fit all. And as we're reaching youth, what are those differentiated models of care and services that we can look at to ensure that we're reaching youth? And to do that, we have to make sure that youth are part of the process. We really need to make sure that we're consulting with them, that they're part of our programs, that we're not just giving lip service to youth programming, but we're actually involving youth in these dialogues and making sure that they're actually present in meetings like this and others to actually see what they want, and different types of youth to be part of these meetings. So I think we need to spend more time listening. I think today's opportunity is going to give us some good feedback. I know there's a youth TED Talk that's being planned, or TED Tile Talk that's being planned. So I think these voices of the youth, these voices of the evidence, what the data is showing us, is going to be really important as we move forward to look at the programming. And I think this is an idea for us, of how we support the government. I think it's great, Dr. Sigdar, that you're here today, really guiding us through this process. USAID has been a steadfast partner with the government, especially on family planning, over decades of engagement. And we're really working on bringing the public sector, the private sector, and the community sector all together to really harness new ideas. And I think one of the greatest examples we have is injectables, and what USAID has done in the injectable space, starting in the private sector, then doing the proof of concept, and then with the government really leading the injectable rollout across the country, which will impact millions and millions and millions of people. And so being a part of that program, being a catalyst, is what we look at USAID, and why we want to bring people together today is to find these new ideas and spark these new ideas that we can do the proof of concept and test, that then government can scale up once the evidence is there that this works. And so today's meeting provides us as an opportunity for us to reflect on the availability of contraceptives across India, analyze the trends, and discuss the challenges that prevent progress. And then once we discuss those challenges, how do we mobilize our efforts and commitments towards the FP 2020 agenda and ensuring that different women and young girls have access to services and contraceptive choices. And so I encourage each of you today to think about how you can partner with other groups, other people in this room, and to look at how we can take India's family planning program to the next level. I mentioned in this room we have representatives from a variety of different walks of life, which is really powerful. And each one of you play a very critical role in how to expand access and quality of family planning services in India. And I think the idea also, going back to the idea of youth and really looking at, while we look at family planning services and delivery, we really have to think about some of these other factors that really are important. The importance of family planning as a right and a human right, and really ensuring that we work on issues around gender-based violence, and addressing the things to ensure that women have choices to actually seek family planning services if they choose to do so. And really making sure as part of that conversation that we engage men and boys. Changing those norms, changing those mindsets is a long-term process, but how do we also work in the space is going to be very important. So again, I look forward to the day. I thank you for coming, spending your time. I know everyone is very busy, but I think opportunities like this provide us a great chance to really think outside the box and push the envelope to see how we can develop new models and new tools to impact the lives of millions of people across India. So thank you very much.